Are you facing challenges in your health? Then Dr. Suleiman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Suleiman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Suleiman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at Mile 18 Bolifamba, and in Douala, we are located at Entre Pilot. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Suleiman.
Good morning to everybody out there. How are you today? This is Dr. Solomon, another session with Your Health Today. We're going to discuss something that is very common and bothers a lot of people, which is heartburn. I feel burning sensation right here. That's a condition called GERD, gastroesophageal reflux disease. Gastroesophageal, this is exactly where the problem is. Gastro means stomach. Esophageal means the esophagus. This esophagus is basically the tube that connects your mouth to the stomach where the acid is. The stomach main function is partial digestion of food by means of something called hydrochloric acid. Hydrochloric acid is very acidic. If you put your finger there and touch the acid, you will get burned. Okay? That's how strong the acid is. Hydrochloric acid. That acid digests food, especially meat. Partial digestion, then the remains of the digestion will be alongside the GI tract till you get till that meat get broken down into the simplest form possible called amino acids, and it gets to your blood. So it is essential for us to have a stomach. That is the first, basically the second station. The first station for food to go through is the mouth. And the mouth, we have the saliva, which also can digest food. It has enzymes there, especially starch. We have amylase in the saliva that can also digest food. So this is the second and most important station, especially when it comes to digesting proteins like chicken, fish, eggs, beef, all this kind of meat. And protein is digested mainly in the stomach. So the stomach is very important for us. So gastroesophageal meaning the connection between the esophagus, which is just a tube that transmits the food from the mouth into the stomach, and the gastro, which is the stomach. At that junction, there is a sphincter. A sphincter means like a valve. I don't know, I think Mr. Johnson can play the first image where it shows the stomach, and then we can have a little bit more detail so you can see what I'm talking about. Anyhow, that connection between the esophagus and the stomach is a sphincter. It's supposed to be tight. After food gets into the stomach, that sphincter, which is this valve, closes down. And if it closes down, that means I'm preventing the ascending of the acid or the acid fumes through the esophagus or to the esophagus. This is what I'm talking about here. So the esophagus is that higher part there where it says esophagus, and then that esophagus ends up to the stomach, and at the junction between the esophagus and the stomach, we see the sphincter, which we call LES or lower esophageal sphincter. So if there is lower esophageal sphincter, that means it has to be an upper esophageal sphincter. The upper esophageal sphincter is not my issue today. My issue today for the presentation of patients with GERD is the LES, lower esophageal sphincter, which connects the esophagus, which is just a tube for the food to pass, to the stomach, where the food is stored and the protein is being partially digested by an acid and some enzymes. But the most important thing that causes our concerns about this disease is the acid in the stomach. Which acid? Hydrochloric acid. So the pH inside the stomach is about 1 to 2. So it's about 1 most of the time, 1.5 or so. That is very acidic. That is very acidic. It can digest meat, meaning it can break meat into the simpler form or the similar form, because there is a simplest form down below at the level of the intestine called amino acid. Then you can imagine how strong that acid is. So if this acid then happened to ascend up when there is a problem with this sphincter, the sphincter function is to close when the food get down to the stomach. That is the sphincter function. What if the sphincter failed to close? What if the sphincter failed to close? Then we have this acid, and this acid fumes that happen as a result of digestion ascending up to the esophagus. So when it ascends up to the esophagus, we will have a problem, because with this acid is very strong. So we will feel heartburn, and it's very, very disturbing. Very disturbing. People who have GERD, who have gastroesophageal reflux disease, are very much disturbed. Why? Because it burns. This acid, when it gets to the esophagus, it burns, and it's very bad. Now, some people, when they get these symptoms, they go to a doctor, and the doctor tell them, okay, the next step we're going to do is to do an endoscope. We're going to insert an endoscope there. I don't agree with that. We only do endoscope. Not everybody, have a little bit of heartburn. We do an endoscope, because there is an indication to do an endoscope. And I see patients in the clinic whereby most of the times, everybody is getting an endoscope for GERD. No, we do not do endoscope unless there is 2 conditions. First, let's discuss when that sphincter, the LES, the lower esophageal sphincter, that sphincter that connects the esophagus with the stomach, failed to close. Then we said we have a problem. This patient will have ascending gas, or from the acid, or the gas, or the acid itself, and that burns. You remember, it digests protein. It breaks down meat pieces that you eat. It breaks it down. So you can imagine if it touches your stomach, your esophagus, you will have burn. Now, this, sphincter can be defected small, mild, or can be defected big times. That means when it's defected big times, we're gonna have ascending of food that you have eaten before, ascending through the stomach, especially at night. So at night, the patient will cough. So when you cough only at night, and you have this heartburn, that we know what is the problem. The problem is the sphincter is too bad. That LES sphincter is too bad, that allows food that you have eaten before to ascend up, because when you sleep like this. So if you stand up, by gravity means the food is very difficult to come up because the gravity. But when you lie down, it's very much easy for the food that's in the stomach to regurge. Regurge meaning it comes back from the stomach into the esophagus, into the mouth. So when you wake up in the morning, you see a lot of food in the pillowcase next to your mouth that you have regurged through the night. So in this case, we recommend that you do endoscopy. We recommend that you do endoscopy to evaluate how far is the damage, and also at this case we can do a surgery called fundoplication, and that can resolve the problem, even though there are risks even with the fundoplication, even with the surgery, that it has complication as well. So when we do endoscopy when you see food next to your mouth in the morning, that is regurg food, volume regurg, next to you when you wake up in the morning. The second issue is when somebody has heartburn, the recommendation is something called PPI, proton pump inhibitors, like omeprazole. Everybody knows omeprazole. So omeprazole, it's a good thing to use because omeprazole will will shut down that bomb that secrete the acid inside the stomach. So we use omeprazole. Now there are new drugs that also with omeprazole we can combine another drug that tight up the sphincter. When we tight up the sphincter small, then the gas has no chance and the acid has no chance to ascend up and cause you the heartburn. So this is heartburn. Everybody has it. We can have it in a mild form, we can have it in a moderate form, we can have it in a severe form. It all depends how bad is that esophageal gastric sphincter, the lower esophageal sphincter, how bad it is, how damaged it is. Does it close after food gets into the stomach or remains open? Now, again, to repeat, to know that you have GERD, that this is the burn in the chest. You feel burning, not stress, pressure. Burning is different. Burning, like something is burning there. That is gastro reflux disease. It happens when you eat a big meal, that especially if it's spicy, when you fill up the stomach too much, the sphincter will have difficulty to close. So when the sphincter having difficulty to close, that means it remains open small, gas and fumes of the gas ascend up and you feel it. So you not necessarily have a bad valve, you just overeating. You ate too much. That's why we have this scenario happening. So, but this, when the stomach size goes low, so is the the reflux goes off and it disappears, and you're feeling normal. But those who have permanent defect in the sphincter, those are the ones I mean by this session here. Those are the ones that we say the sphincter could be mild, could be moderate, could be severe. Mild and all the way up to moderate, we only treat with omeprazole. Lowest dose possible, and we monitor. If we have a problem still, we can add another drug called domperidone, and that will close the sphincter for me. This has to be done by a physician, not by you. I do not recommend doing endoscopy for anybody with heartburn unless we see severe destruction and damage of that LES, lower esophageal sphincter, which is the sign of which will be you see food when you wake up in the morning, and you always cough at night. Only at night. You always cough, because in the daytime you're standing up. There is less chance for the acid to come up. But at night when you sleep, then we have irritation because of this acid coming through the pharynx, through the esophagus, through the larynx. So you have a little bit of hoarseness, your voice become a bit thicker, and you have nocturnal cough, which is nighttime cough all the times. And this is the indication for endoscopy at this time.